Welcome to our channel. Today we're diving into an important topic that affects millions. Type 2 diabetes. We'll explore how you can prevent, manage, and even potentially reverse this condition. So let's get started. Type 2 diabetes is increasingly common even among young people and adolescents. According to the Centers for Disease Control and Prevention, about 38 million Americans have diabetes, and approximately 90 to 95% of them have type 2 diabetes. This condition most often develops in people over age 45, but more and more children, teens, and young adults are also developing it. Type 2 diabetes is a metabolic disorder characterized by the accumulation of glucose or sugar in the blood instead of being used as fuel by the body's cells. This occurs due to problems with insulin, a hormone produced by the pancreas. Insulin is essential for glucose metabolism and muscle growth. It helps glucose enter cells, reducing blood sugar levels. Stable insulin levels, maintained by high-quality carbohydrates, fiber, and proteins, are vital for muscle hypertrophy. Insulin resistance, a precursor to diabetes, is influenced by genetic factors and body fat distribution, particularly visceral fat. Type 2 diabetes can lead to blindness, nerve damage, kidney disease, heart and blood vessel disease like hypertension by affecting both small and large blood vessels. It decreases the kidney's ability to eliminate water and salt and stiffens large vessels, increasing blood pressure. Additionally, diabetes affects the nervous system, particularly the sympathetic system that regulates blood pressure, causing vessels to constrict and pressure to rise. So, can diabetes be cured? The good news is, diabetes remission is possible, especially in the early stages. Maintaining a normal weight, an active lifestyle, and quality sleep are key preventative measures. Muscle mass plays a crucial role in preventing various health issues, including diabetes. Insulin plays an anabolic role, stimulating cell growth and lowering blood sugar levels. A diet rich in quality carbohydrates can help with muscle growth and prevention of insulin resistance. However, insulin abuse can lead to insulin resistance. Fat distribution, influenced by genetic factors, plays a crucial role in the risk of diabetes and metabolic syndrome. Subcutaneous fat can have a protective role, while visceral fat is a risk factor. Caloric excess can lead to fat deposition in the liver and pancreas, causing insulin resistance and hyperinsulinism. Overeating, unhealthy eating, and consuming excess calories, especially from fast-absorbing sugars, can lead to insulin resistance and type 2 diabetes. Monitoring your abdominal circumference can help assess your risk. Women should aim for under 80 centimeters, men under 94 centimeters. Prediabetes is a warning sign. Blood sugar levels between 100 and 125 milligrams per deciliter after fasting for 8 hours may indicate prediabetes. Early intervention with lifestyle changes can prevent progression to diabetes. The great news? Prediabetes can be reversed. Diet changes, physical exercise, and weight loss can reduce blood sugar levels. Regular blood sugar monitoring, especially for those over 30, is recommended. Here are some practical tips for a healthier lifestyle. Drink more water and fewer sugary drinks. Eat more fruits and vegetables. And get kids involved in making healthier meals. Eating slowly and only at the dinner table can also help manage your weight. Physical activity is essential. Aim for at least 60 minutes of exercise a day, whether in several short sessions or all at once. Keep it fun and positive by trying new activities and involving your family. Limit screen time and plan active outings together. Adequate muscle mass can prevent diabetes. A sedentary lifestyle and weight gain can lead to prediabetes and diabetes. Insulin resistance and hyperinsulinemia can occur before changes in blood sugar levels, so maintaining an active lifestyle is crucial. Smoking increases the risk of type 2 diabetes. Quitting smoking can improve insulin sensitivity and reduce the risk of diabetes. It also brings numerous other health benefits. Polycystic ovary syndrome also increases the risk of diabetes due to associated insulin resistance. Genetic factors and lifestyle choices influence diabetes risk. Abdominal circumference is a simple method to assess this risk. Fasting blood sugar levels between 100 and 125 milligrams per deciliter indicate prediabetes, while levels above 126 suggest diabetes. Regular monitoring is essential. Using a glucometer should be as frequent as measuring blood pressure. Continuous glucose monitoring sensors provide accurate insights for those on insulin treatment. Confirm sensor results through laboratory tests for accuracy. Fast food and certain carbs can spike blood sugar levels. Glucose sensors help identify how your body reacts to different foods. Fructose, found in fruits, should be balanced as it can affect blood triglyceride levels. However, fruits provide essential fibers and nutrients. For satiety and diabetes control, prioritize proteins and fibers in your diet. Avoid common mistakes like insufficient vegetable intake and irregular eating habits. Keeping a food journal can help maintain a healthy diet. Managing stress is crucial as it can affect blood sugar levels and insulin sensitivity. Engage in stress-reducing activities like mindfulness, yoga, or regular exercise to manage stress effectively. Limit your alcohol intake. Excessive alcohol consumption can lead to weight gain and affect blood sugar levels. Moderating your intake helps maintain a healthy weight and reduces diabetes risk. Regular checkups with your healthcare provider can monitor risk factors for type 2 diabetes, such as blood pressure, cholesterol, and blood glucose levels. Early detection of risk factors enables early intervention. Signs to watch for include a BMI over 28 kilograms per square meter, excessive thirst, frequent urination, fatigue, high blood sugar, night sweats, slow wound healing, frequent infections, weight gain, and physical weakness. Key blood tests for glucose health are also essential. A fasting glucose level over 100 milligrams per deciliter, a HOMA index over 2, or an elevated glycosylated hemoglobin, HbA1c, over 5.7% indicates you're headed for diabetes. In countries like Australia, the United Kingdom, Canada, and Switzerland, glucose levels are measured in millimoles per litre instead of milligrams per deciliter, so the values will look different. Quality sleep is vital for diabetes prevention. During sleep, glucose and insulin levels decrease, basal metabolism supports cell regeneration, and hormones like ghrelin and leptin are regulated. Additionally, intermittent fasting can lower blood sugar and insulin levels while increasing insulin sensitivity. Thanks for watching. If you found this video helpful, give it a thumbs up, share it with friends, and subscribe for more health tips. Remember, your health is in your hands. Stay active, eat well, and take control of your future. Until next time, stay healthy and stay informed.